If you've had breast reconstruction, do you need to follow with your plastic surgeon for the rest of your life? It depends. If you've had a flap reconstruction, so your breasts are made of your own tissue, if you're happy with your reconstruction, you really don't need to follow with a plastic surgeon. Now, you might want to. As age and gravity works, you might want a revision surgery, but there's really nothing that we're monitoring. This is very different from implants. If you have implant-based reconstruction, I do recommend at least touching base with your plastic surgeon annually. That could involve just a touch point, a conversation, making sure there's no changes, a physical exam, but it is recommended that about every 3 years you get an ultrasound to look at the implant. This has nothing to do with cancer surveillance. It's literally just looking at the integrity of the implant. We've talked before about how implants at about 10 years have a 10% rupture rate. And so you want to be on top of that. You want to be having ultrasounds, especially if you're opting not to have that revision surgery, to make sure there's not a rupture that you're not aware of. Now, this timeline would be changed if you notice anything that changes with your breast, things look different, feel different, you've had a trauma to your breast and you're concerned about rupture, then you would need to see your plastic surgeon more frequently than that every year visit. But if you've had implant-based breast reconstruction and you haven't seen your surgeon for a year, reach up and schedule a follow-up appointment.